was awake during the whole procedure.
Taking the good with the ups and downs. I wanna see how the world turns round. Let's go adventure in the deep blue sea. Home is with you wherever that may be. Home is with you wherever that may be.
Yes, it's Claire Isabel Wilson, and my date of birth is 8/26/87.
Put your mask right underneath your nose. Pull it down underneath your nose for me. Keep your mouth covered for me, ma'am. Thank you. Raise your head up a little bit. Just like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, so the results will straight to your doctor within 48 hours, okay?
Okay, thank you. Woo, that was fun.
That was the most fun you've had?
Oh yeah. Both nostrils this time. Super fun. Double the fun. Last time they only did one nostril, and at the hospital they usually do one nostril, like for flu tests and stuff. So that was extra fun.
Sure.
So I had my COVID test for my biopsy. My bone marrow biopsy is finally going to be this Thursday. Today is Monday the 15th, and yeah, I tried to film it, but they don't allow filming, so I had to be really discreet about it. But yeah, they did 2 swabs this time. Last time they did 1 swab, but this time they did 1 each up each nostril, and it was for 10 seconds. Like, she counted to 10, like 1, 2, 3, and it was like, it was the longest 10 seconds ever, but it's cool. It's all over with. It was pretty quick overall, but it was double the length of time as last time, because last time it was just 1 nostril. So that was interesting. Yeah, I had to check out this questionnaire beforehand about my symptoms. Like, I had to check that I had all these symptoms because I have most COVID symptoms, but they're my normal symptoms. So I have had them since at least 2012, so they know that it's not COVID. But yeah, I'm so grateful to be out of the house. I feel so alive and free, and it's a really nice day. It's like, what do you think, in the 60s?
Let's see what no, it's 47.
Oh, well, just kidding. It's 47, but I don't know. It could be worse.
It could be warm.
It could be warmer. I like it warmer, but you know, it could be worse too. So I'm just really grateful to be out of the house, and yeah, even if it's just for a COVID test. That was really all that was on the schedule for today. I'm gonna go back home and rest. I've been having a really hard time at home with a lot of fatigue and a lot of really rough symptoms, a lot of pain in my back and in my left kidney. I have to see my nephrologist about that, and I'm in the process of getting tested for heart failure and what stage I'm at. I have to pick up a heart monitor. I have to schedule that, so I'm going to do that tomorrow. I'm going to schedule it tomorrow. And yeah, that is it for today. I just wanted to give a quick little update, so I will catch you guys on Thursday when I have my bone marrow biopsy. Today is the big day. Today is my bone marrow biopsy. It's gonna be a doozy. I am so tired. I barely slept last night because of nerves. Even though I'm exhausted beyond belief. So thankfully I slept a lot yesterday. I got a lot of sleep the night before last night, which hopefully will help me get through the day. I have to be there at 9:30. It is about 8:30 right now. Thankfully the hospital's close by, so I can just leave like 10 minutes before the appointment, maybe 15 minutes to find parking, because parking is always hard at the hospital. So, but yeah, I'm glad today has finally come, and I am gonna get myself ready, get my IV fluids going. I've been running them continuously, as you can see. since yesterday because I had to fast from foods and liquids from midnight. And since I do have POTS, fasting from liquids is extremely hard for me, so I do need to do continuous IV fluids from now until at least tomorrow to keep me at least relatively hydrated enough to get through the day. So yeah, I just took a little water for my meds. That's all I was allowed. I took my inhaler. I'm not going to do my breathing treatment this morning. Don't really have time. I might, depending on my breathing is kind of rough, so I might do it. I don't know. I'm not sure yet. But I need to set up my IV first. That's number one. Get dressed, and then, yeah, I'm going to call the hospital to talk to the nurse to make sure I have the instructions right on where to go. And yeah, that's that for today. I am really nervous / excited to get this over with. Here at the hospital for my biopsy, and I checked in another room, and then they sent me over to this waiting room for some blood work. And yeah, they told me to come at 9:30, and it's already like almost 10, and I haven't really done anything but register and wait, so, but that's normal, the hospital, a lot of waiting. So yeah, and also they made me take off my mask and put like another one of these cloth masks, I don't know why. But yeah, that's the update for now. Hello. You're on candid camera. So I'm here in my little bay in interventional radiology, and I'm about to change into my gown. I have to disconnect from my fluids, so it's a bit of a challenge, but I'm excited that we're finally in the room and getting ready. I keep doing this upside down for some reason. How do I look in my gown? Check out these socks. These are actually really cool, minus the color. I like how long they are. I've always wanted like knee socks. I mean, I think I have some at home, but these are so much cooler, don't you think?
Posey was my grandma's dog's name.
Well, it's so random. What was the name?
Posey. The name of the sock.
Oh, Posey. Oh, that's cute.
Alex, let me get glue. 30.
Room tour.
Yeah, let me get Dermabond. Got it. Do you want a baby one?
Trying to do like a 360 for a room tour. Still here waiting. There's a little delay. The doctor, I guess, got caught up with the procedure he was in before me. So it's like 12 o'clock, and I've been here since 9:30. But that's okay. Just chilling. Luckily, I'm not in too much pain or anything right now. But yeah, soon they're going to take me downstairs for a CT scan of my back so they can figure out where they're going to do the biopsy, and that's when I think they're going to sedate me. And the procedure, I think he said, would be 45 minutes total. So yeah, I'm not going to be allowed to film down there or take my camera down, so I will probably see you guys after my biopsy. It's too close. Is the angle okay?
Yeah, I think so.
So I had the biopsy, and I'm still really groggy from the sedation. They had to give me 2 shots of Versed, which is the sedation, because it didn't make me sleepy after the first shot. It was like totally awake. And then they also gave me 2 shots of fentanyl because the first shot didn't help the pain. And I was awake during the whole procedure. It was really painful, but thankfully I had the 2nd dose of fentanyl, which helps. Otherwise it would be probably unbearable. That was my worst fear, was that I was going to be awake. but I actually got more sleepy after the procedure was over. It was like a really delayed reaction with the sedation medications. But luckily, because I got 2 doses of fentanyl, which is a really strong pain med, that is a narcotic, and that's keeping my pain okay right now. So we'll see how it's going to be later when I get home. Hopefully it won't be too painful. They said I could switch off between ice and heat and stuff. I always use my heating pad anyway at home, so there's always that.
I almost dropped your phone.
Don't do that. So yeah, that's my update for now. I'm really happy that it went well, and they said I should have results in about 10 days. And I have a hematologist appointment to go over the results in 2 weeks, the week after next week. So I might have to wait for 2 weeks to get the results, but praying for clear, good results. Discharged. Oh, you're doing it?
I'm going.
Okay. I'm about to change out of my gown, and I just got disconnected from my IV. I'm gonna hook up back to my line for my saline, and then I'm gonna try to eat something and go back home. So, super thankful it's all done with and that it wasn't unbearably painful, even though I was awake during the procedure. So today is 3 days post-biopsy. I was really doped up from 2 doses of fentanyl, as well as 2 doses of Versed, which is a sedation medication that I was given at the hospital before my biopsy. The first dose clearly didn't work of both the fentanyl and the Versed, so that's why they had to give me double dose of both. I was awake through the whole procedure, but I was doped up enough that the pain wasn't that bad. It was tolerable. It definitely wasn't as bad as I thought it would be, so that's really good. And I got home from the hospital and just like slept the rest of the day. I was really nauseated, so I wasn't really asleep because I couldn't really lay down because I was so nauseous, but I was too out of it to like get on my phone for any updates or like do anything. I was just resting. So and the pain was pretty bad, but it was manageable. Honestly, the pain, like my normal chronic pain from EDS and from my spinal cord injury, degenerative disc disease, arthritis, so forth, all of that pain is much worse, to be honest. My general pain sits at between a 6 and a 7, so I live with really bad pain every day of my life. So the bone marrow biopsy was tolerable. It was actually better than expected. I thought it was going to be like the worst pain ever, but it wasn't that bad. There was no tears, no screaming. I've heard horror stories, so I'm just grateful that it went well. No complications. We were worried about bleeding afterwards because I am on blood thinners for my Lovenox shots for my blood clots. So thankfully no excess bleeding. I am still wearing the bandage. They said I could take it off 24 hours later, but I just haven't bathed yet, so I was waiting to bathe. So I'm probably going to do that later today. And yeah, I will insert a quick picture of what it looks like. Before and after the bandage is taken off. The wound care is very simple. They just said take the bandage off in 24 hours. And, you know, if you need to, you can cover it with another bandage, but they didn't really give that much instruction, so they just said take it easy with your meals after, because the sedation medication would be in my system for 24 hours, and even though it's been 3 days, I still feel pretty nauseated on and off, but that's normal for me because I do have cyclic vomiting syndrome, so it definitely wasn't as bad as it could be. The Zofran and medical marijuana has kept my vomiting at bay, at least, so I can't complain about the nausea. And again, the pain has been manageable, so that's really good. I've just been using my normal pain meds, and I've been getting by okay with that. So I just wanted to give that update. I now have to wait 2 whole weeks to see my hematologist to go over the biopsy results. And I think that's going to be the hardest part, is waiting for the results, honestly. So tomorrow I have my Holter monitor placed at my cardiologist's office. I'll probably be vlogging that in a separate vlog. So this is basically it for the biopsy vlog. I'm gonna definitely update on my Instagram, so go ahead and follow me on my Instagram if you're not already. I post more frequently on there. I do not have the energy, unfortunately, to make videos as much as I would like to, so yeah, you're always free to follow me on there and connect with me on there. I love to connect with you guys. And I'm sorry I haven't been able to keep up with everyone's messages. It's just been really, really hard. I've been so busy with appointments and just exhausted beyond belief ever since my heart valve disease. So yeah, that's kind of where I'm at. I spent the last couple days just sleeping and recovering from my biopsy. Thank God I have my fluids, which help me a ton. And my oxygen has been dropping again, so I am on the oxygen again. That is my update, and I'm really grateful if you made it this far in the video. Please give this a like if you liked it, and subscribe to my YouTube channel if you haven't already. And I will see you guys in my next video. I love you to pieces.